Welcome to my channel once again. Today we are going to look at mechanisms of fluid movement. Okay, so fluid movement in the body occurs across semi-permeable membrane and is governed by physical and chemical forces that maintain fluid balance between these body compartments. So let's look at hydrostatic pressure. So hydrostatic pressure is the force exerted by a fluid against the wall of its container into bracket a blood vessel. So this pushes water and small solids out of the vascular space into tissue via another mechanism called filtration. And then take note that hydrostatic pressure is greater at an arterial end than oncotic pressure, allowing fluid to easily move out of the vascular spaces and into interstitial spaces. So the next mechanism is filtration, which is a build-up point from the hydrostatic pressure. So filtration has to do with the movement of water and then solutes as well across the semi-permeable membrane due to pressure difference. And the pressure difference is as a result of hydrostatic pressure that is in this fluid, pushing pressure on the walls of these vessels, and then now leading to the process of filtration, then moving this fluid out of the vessel into interstitial spaces for cell usage. Or in terms of the kidney, we have filtration at the glomerulus over there as well, where pressure is induced on these capillaries, letting fluid and other substances to seep out of the glomerulus into the kidney tube for excretions to take place. So let's look at the oncotic or keloid osmotic pressure. So this osmotic pressure is exerted by the plasma protein, mainly albumin. It pulls water wholly from the interstitial spaces into the blood vessels. So like this mechanism really do the reverse of the hydrostatic pressure as well as the filtration process. So what it does is that it just return back what has been sent inside the interstitial spaces in order to maintain balance. So we have a clinical relevance of low albumin, which helps in this pressure operation. So when there is low albumin, this level reduces oncotic pressure, leading to edema. So at this point where there is low albumin, meaning oncotic pressure decreases. So that means hydrostatic pressure will be more than the oncotic pressure. So this will cause excess fluid to shoot into interstitial spaces. That will lead to edema. But in normal sense, these processes are supposed to work together so that at the arterial end, hydrostatic pressure does its filtration work over there. Fluid goes into interstitial spaces. Then at the venous end, oncotic pressure is greater, so allowing fluid to move back into the vessels to maintain balance, whereby the lymphatic system plays a role in absorption of excess fluid in the interstitial spaces. But in case where there is low albumin, giving full room for hydrostatic pressure to function properly will now cause movement of water a lot into interstitial spaces, causing edema. So edema truly occurs when hydrostatic pressure is higher than oncotic pressure. So here is a typical diagram over here to summarize all these three mechanisms. So you can see at the far end of your left, that's an arterial end of a capillary where hydrostatic pressure is more than that of oncotic pressure. So fluid goes inside the interstitial spaces. Then you can see at the far right of your hand, you can see where oncotic pressure is greater than that of hydrostatic pressure. So fluid are reabsorbed back into the vessels. Then you can see a net movement where there is no net movement at the middle side of the capillary where these two pressures are equal. So there should be filtration and there should be reabsorption to maintain this balance. So at the point in time where there is a condition maybe related to the heart, the kidney, as well as malnutrition, and then this process are affecting albumin level. So at this point in time, it's going to alter the venous end, causing an increase of hydrostatic pressure rather than oncotic pressure. So right now fluid are filtered in but they are not filtered back. So at the end of the day there will be a lot of accumulation of fluid at the interstitial spaces because there is no room for them to go out. They are just entering and not going out. So we have osmosis. So osmosis is the movement of water only across a mesenchymal membrane with reference to high solute concentration. So water is forced to move from another compartment to another in response to where there is low solute concentration to a place of high solute concentration. And this maintains the cell shape and size, which in reference to the solution's concentration. So where there is low solute concentration in the cell, fluid move into the cell increase in size, and where there is high concentration outside the cell, low concentration in the cell, fluid moves from the cell into the outside of the cell, and then the cell shape and size reduces. And where there is equal concentration at both sides, there is no movement of fluid and the cell shape remains the way it is. So osmolarity and fluid movement, we've done this severally in my previous presentation, so I'm not going to talk much about it. All I have to say is that osmolarity also plays a role in fluid movement. So where there is more solute pulls water, where there is less solute water moves away from that side, and where there is equal proportion of solute there is no net movement of water. So thank you for your time, until we meet next time again.